and welcome to Health Europe. My name's Eloise McLennan and I am Pharma Forum's Deep Dive Editor. I'm here with Scott Honken, who is Chief Commercial Officer for WeightWatchers. Now, Scott, you've just come off of a panel where we were discussing GLP-1s. Love to hear your first takeaways because there were so many great insights. Where do you see the biggest takeaway on where the GLP-1 conversation is right now?
Yeah, great question. I think it's really interesting and dynamic market for sure right now. It was really interesting to see some of the the parallels, being U.S. based, but at WeightWatchers also having an international presence and markets here in Europe as well. A lot of the dynamics I think that have played out in the U.S. Are playing out here in Europe as well. And so I think we're seeing a lot more utilization of GLP-1 medications for sure. And also starting to, have some of those same, conversations from a coverage perspective and, what programs can go along with the medications, et cetera, as well. And so, now over the past bit of time since the, supply shortages have really been resolved for the most part, it's kind of renewed some of those, topics that were maybe put on the back burner for a time. And so, definitely been a really interesting and dynamic market for sure.
And WeightWatchers has just made, I believe in May, some big moves in the GLP-1 space. So how do you see the company's role evolving as the landscape evolves? As you say, we're now back from supply shortages. We're sort of moving into an era of people are on these medications. So what now?
Yeah. And so, at WeightWatchers, we really try and meet members where they are. And so, I'll answer this maybe in two ways. In the U.S., that means kind of a fully comprehensive program, everything from maybe the behavioral program or points program, which for a long-term period of time. We also have what we call our GLP-1 companion or the wraparound services that can sit alongside a member regardless of where they get their prescription from. And then in the U.S., we also have WeightWatchers Clinic, which is kind of a virtual clinic that can provide all of the provider support and write the prescriptions, as well. And so in our international markets, we don't have a WeightWatchers Clinic owned and operated ourselves internationally. We do have the behavioral program and the companion program. And, to this point, we've started, to look at some partnership opportunities. And that's kind of been our solution to the comprehensive platform. And so, that's really our overall lens is as the landscape evolves and we're seeing how members are choosing to engage either with or without medication, can we be there to support them with kind of a science-backed, doctor-recommended approach? And that's kind of the strategic overview at right now.
And I want to come back and touch on that in a moment. But First of all, I'd like to ask, what's the biggest differences that you're seeing between the US and the European market?
Yeah, I think I'll maybe answer it in two ways. So in the UK, I would say some of the consumerization and members looking for the medications and even paying out of pocket is much more similar to the US than we're seeing elsewhere in Europe. And so I would say that's both a similarity and a difference in a lot of respects where, the rise of virtual clinics and members kind of engaging in that healthcare experience in the U.S., it's a different coverage environment. So that's maybe both a similarity and a difference for sure. But then if you look at from like an overall coverage of the medications perspective, that's still fairly different, maybe more employer by employer and health plan by health plan in the U.S. Versus in Europe, still maybe kind of landing on what that coverage framework is going to be. And I think that'll be one of the interesting things that plays out over the next couple of years of what that looks like from an overall coverage and reimbursement perspective.
And you mentioned during the panel the need to move beyond BMI because we know now, we've seen it, that there are multiple indications that GLP-1s can be used for. Can you unpack that for us about the need to move beyond just BMI and why that shift's important right now?
For sure. And what we've seen is that, and I'll maybe give you the coverage landscape in the U.S. has been the FDA approved the GLP-1 medications with a BMI 27 or higher with a comorbidity or 30 or higher alone. However, there's been a lot of research and just academic opinion coming out that using BMI alone is really not sufficient. And kind of one of the examples being, you could have an individual with a BMI of 30 that exercises a lot, does a lot of strength training, and is really metabolically healthy. Where you could have somebody with a BMI of 29 or 30 with 3 additional comorbidities, and that's a very different health profile. And so the coverage framework and just relying on BMI alone is not the best measure, especially if you think about a lot of the concerns of cost of the medications, and using maybe kind of a simple or a very wide approach, if you will, from the coverage lens when the costs are so important. And so I think that's why we're kind of looking at, are there ways to get more nuanced, from like who will benefit the most from these medications, especially when we're starting to think about how can we extend as much coverage as possible in a way that the whatever system it is can afford.
And there's a lot of talk about starting GLP-1s, but less of a conversation around sticking with them. So what are the biggest challenges surrounding adherence? And this is one that I think would be quite interesting with Weight Watchers, is the community aspect. Weight Watchers has a huge community aspect. So how is that structure and that assistance around the medication itself, how are you helping to address those challenges?
Yeah, for sure. And I think that's where what we call our GLP-1 companion program comes in. And so that's a program that sits alongside a use of the medication, regardless of where you get the prescription from. And so whether it's our virtual clinic in the US or your primary care provider in the US or an international market, and that includes elements of strength training and some of the macronutrient targets that are important if you're using a GLP-1 to help avoid muscle loss, etc. But importantly, also is that community aspect as well. And so our workshops, whether they're in person or virtual options as well, is a nice a component there, both for support for members as they're leveraging one of the medications. Interestingly, in a variety of areas and markets, there's also a stigma with use of the medication as well, and so the community aspect can help there too. So I think that piece is definitely important, especially when you look at the data is pretty clear. We've seen this in our own data, and especially published trials as well, where if somebody uses a medication, does nothing else, no behavior change, and then stops the medication 6 months or 12 months down the line, it's a very high likelihood they're going to regain most or all of that weight. And so adherence is important, but then also what pieces are you combining with the medication throughout their treatment journey?
Yeah, because if you're paying out of pocket and you stop taking the medicine 3 months after you start it, you've paid a lot of money to then gain it all back again.
Absolutely.
But talking about more adherence and longer term benefits, you mentioned on stage that, was it 2 to 3 years you start to see the longer term benefits, and that the benefits are more complex than just one patient loses weight. So can you talk us through how we can best explain that to payers to keep them investing in this particular market, so that we do see those longer term benefits and you don't just lose the momentum after 1 year?
Yeah, definitely. And if you look at the cost savings here, it's an interesting area because the initial costs are very much going to be from a pharmacy perspective, fairly straightforward with use of the medication, but the cost savings are on the medical side. And so you have to really take that holistic view in a lot of ways. And so if you're looking at what things to be impacted by weight, we know that there's dozens, if not more, of chronic conditions that can be improved by weight, various cancers, etc. And so I think that broad lens is really important, and taking a look at how many less people had developed diabetes over that period of time, emergency room utilization, and a variety of other chronic conditions. And so, as you mentioned, in the US, some of that data is just emerging on getting to that time period of enough people 2 to 3 years down the line of saying, all right, well, what has happened from a cost perspective over that lens? we're starting to see some encouraging signs of, even with, let's say $500 plus per month GLP-1 costs in the US, the medical cost savings are going to be enough. It's looking like with some of that early data. Now we need a lot more data. We need it broader in a variety of markets, et cetera. But I would say taking that broad lens, realizing it'll be pharmacy cost increase up front, medical cost savings over time, and then also looking at what are all those things that could be impacted by these medications across a variety number of people will be really important to track over the coming years.
And say we're sitting here next year, what do you hope will have changed in the public conversation around GLP-1s and particularly weight management?
Great question. I think one is definitely recognizing that, if you look at incidences of obesity, diabetes, et cetera, they're multimodal. And so GLP-1s are a tool in that arsenal. Not for everybody, for sure. And so, we really believe finding the right person to get the medication and then, the right person for the right amount of time. But as far as like changing the conversation, I think recognizing that GLP-1s are an important tool in solving the overall challenge will be really key. And so maybe tie a couple of themes together of both, maybe BMI as imperfect, but that said, it's a tool we have today, and there's clear positive results. If you look at individuals at, let's say, a BMI of 35 is the one I typically go to and higher. So say broader coverage and recognition of the utility of these medications across that landscape, but also a much easier, whether it's coverage environment, that recognizes what happens between clinical visits is really important. And how do we maximize the use of those wraparound services, companion programs, et cetera, whether it's virtual or in person, because I think it could happen, in both ways. But ramping up the utilization of that as we see the increased use of GLP-1s, I think would be great if we're sitting here and saw that a year from now.
And my final question for you, we've looked a little bit long term, 1 year in the future. If you could snap your fingers today and dispel one myth or misconception about GLP-1s, what would that be and why?
Great question. I think it would be that there's probably some view that GLP-1s are a silver bullet because of the great efficacy, the number of people using the medications now. But there's also the other element of that, where if the only thing you do and change about a person's habits, et cetera, is using that GLP-1 medication, the odds are really high they're going to end up where they started over a short-term period of time. And so they're a fantastic tool. They're highly efficacious, but they're really maximized if you can say, here's a great tool. Let's combine that with some science-backed support, community, et cetera, and then drive those sustained outcomes. That's kind of the winning combination. And so not a silver bullet, but maybe one of the best tools we've had, but combine that with whatever tool you can add on top to make it the very best of the best.
Well, thank you very much for speaking to me, Scott. Thank you so much for watching, and do stay tuned for more updates from Health 2025. Thanks very much.